Okay, I think we can start. Thank you so much, all of you, for joining us in this event. Everybody, Oxygen Therapy, Strategies, Protocols, and Case Studies. We have three wonderful speakers today. I'm going to introduce one of each when they start their presentation. Some important things, some rules that we must follow during the event. You're not allowed to open your mics, and try to not open your camera also, so we can flow with the presentations and not interrupting our colleagues, and we can just move forward with their presentations. So at the end of this event, we're gonna we have a kind of surprise that the Mira, the International Hyperbaric Medicine and Research Association, gave us for you guys that registered on this event today. So try to wait to the end of the event so you can feel your information, and also get the gift that the Mira gave especially to us for this event. So let's start with the symposium. So the first of our guests, of our speakers, Dr. Randy. I don't know if Randy is in the room. Randy, how are you? Are you there?
Yep, I'm here.
There you go. How are you, Randy?
I'm
nice
good.
to see you again. Good. So Randy, it's gonna be our first speaker today. He's the Chief Medical Officer of the Amine of All Seasons, Chief Operating Officer of Physician Optimal Health. And also is leading the industry with his research in neurocognitive disease, such as dementia and Alzheimer. So Randy, the Zoom is yours, so you can start sharing as soon as you want. Yeah, there you go. Perfect. Thank you, Randy.
Okay. Hey, I wanted to thank Mira and Biobarica for sponsoring this symposium. Every opportunity that I have to share information about how to protect people's brains is a delight, because we're in a pandemic right now with people that have neurodegenerative diseases. And most people think there's nothing that you can do. And I disagree with that. I think there's so much that can be done. So with that being said, I'm going to go ahead and launch into my presentation. I became interested in hyperbaric medicine a couple of years ago, and I'm an avid reader. So I started reading a couple of books and some information about hyperbaric, but was not practicing it. In 2023, I scheduled some classes and then finished my board certification with the International Board of Undersea Medicine and Hyperbarics last year. This is a picture with me at a large hyperbaric clinic up in Washington State with Jason Saunders. And if you follow individuals who practice hyperbaric medicine or do a lot of social media, Jason Saunders is all over social media. So it's kind of fun. We become good friends through that board certification process. Because my love is neurological health, I've been reading about how to help people that have neurological diseases. For 10 years, I worked in a psychiatric hospital and a skilled nursing facility, and I took care of aging seniors with dementia. And I always lamented at how terrible the medicine was. Medicines don't make dementia better. And so I was constantly searching for solutions that would help my patients. I read this book called The End of Alzheimer's. Dr. Bredesen is a neurologist from UCLA, and look at the subtitle: The First Program to Prevent and Reverse Cognitive Decline. So he's bold enough to say, it's not that you can prevent Alzheimer's, we actually think you can reverse many of the challenges associated with it. So I wanted to learn more. Dr. Bredesen makes the comment that Alzheimer's should be rare. It should be as rare as leprosy and polio. Now, I don't know about the rest of you that practice medicine, but in 20 years, I've never seen leprosy. I've never seen it. I've worked in urgent care and family medicine. I've worked in acute care in the hospitals and ICU, and I've never seen leprosy. And I've seen post-polio syndrome, but I've never seen active polio. So it's a very bold statement for this neurologist to suggest that Alzheimer's disease should be as rare as leprosy or polio. That's a mind-blowing statement. I started training under Dr. Bredesen's care in 2017. He launched a service called Recode 2.0, and I've gone through all the continuing education associated with trying to understand what gives people neurodegenerative disease. I'm very active on social media, and this is a screenshot of my Instagram account. People are always asking me questions. They say, can you actually prevent dementia? What if my parents have it? Can I prevent it? Or what if I have a diagnosis and I'm in the early stages, like subjective cognitive impairment or mild cognitive impairment? Can that be reversed or unwound? People will ask me, well, what if both of my parents ended up in nursing homes and they had dementia? Am I bound to get it? Or what if I have the genetic test that show I have APOE4 alleles and I'm positive for APOE4? Does that mean I'm guaranteed to get Alzheimer's disease? And then last but not least, people are always saying, Randy, what do I do? What is your approach for Alzheimer's disease? So the brain has an aging process. And I think that the community at large, the population at large, expects the brain to deteriorate as we age, right? I'm in my 50s. And I have a lot of people that say, well, hey, I'm in my 50s, so my mind isn't going to be as clear or as sharp as it was when I'm in my 30s. I have issues with that. I think it should be as sharp. I think it can be, or it can get more sharp. The problem is that people's plasticity, their ability to develop antioxidants and develop new synapses and make new connections tends to break down through the aging process. But I think that we can stop that. And in many cases, I think we can reverse it, where we can turn the brain to a really vital, a high degree of vitality and a high degree of neuroplasticity. I've named my approach the enhanced protocol, because the goal is to take someone where they're at today and enhance them, help them do better. There's no guarantees that people are going to gain back all of their deficits, but I think that we can certainly make a significant improvement in those instances. Okay, so people will ask me, well, okay, what are the foundational approaches to brain health? And I've listed them here. These are not things you can get in a pill. You can't take these in a nutritional supplement form. These are things that individuals have to own if they want their brain health to be good. They have to protect their sleep. They have to be physically active and eat a healthy diet. The amount of research about processed foods leading to neurodegenerative diseases are profound, and yet most of the world still eats a lot of processed food. Most people don't realize that dental health, persistent cavities or abscesses or root canals that have been there a long time and go bad, they contribute to Alzheimer's disease. We live in a world that believes in moderation in all things. A little bit of alcohol is not that big a deal. But if you have any form of brain fog or neurodegenerative decline, the argument of moderation doesn't exist, because alcohol is a neurotoxin. We say people get intoxicated. So I'm constantly encouraging people, leave that behind. It's not going to help your sleep. It's going to make your brain worse. And then there are brain stimulatory things that we can do to improve brain function. I won't have time to talk through those today. But I'm a fan of testing brain health in the beginning and implementing these foundational pieces and then coming back and testing for brain health. If people are making progress, then we continue what I call lifestyle medicine. We just keep doing what we know is working well. But when people do not make progress and they don't cross that threshold where they're doing better, we have to intervene. We have to address triggers of neurodegenerative disease. So I want to take a few minutes and introduce these to you. Neurodegenerative disease can take on 4 flavors. It can be a motor problem like you would see in Parkinson's disease. It could be a sensory problem like you would see with people that have peripheral neuropathy. It can also have a behavioral component like mental health challenges. I very much view chronic depression and anxiety in the same light as I view Alzheimer's disease. It's an inflammatory process in the brain long before it's a chemical imbalance. And then there's cognitive problems, right? People can say, I have brain fog. I'm losing my memory. I can't remember things like I did before. I'm more organized. I got attention deficit disorders, and I didn't used to. So these are types of neurological dysfunction, and I want to walk you through the triggers. So the first one can be infections. We're coming off the global pandemic of COVID, and we know that about 10% of the people that had COVID have a long haulers component. That's a neurological problem. And even in the early stages of COVID, the early symptoms were loss of sense of taste and the loss of sense of smell. Those are neurological problems. Another issue that happens often with COVID or with neurological disorders is vascular problems. This is probably the #1 issue that are driving neurological disorders, that people have poor blood flow to the brain. And I'll come back to that here in just a minute once I introduce these. There's an element of autoimmune disease. If an individual has rheumatoid arthritis or psoriatic arthritis, or if they have ankylosing spondylitis, they likely are at higher risk of having an autoimmune process in the brain that leads to neurodegenerative disease. And I'm talking about things that go far beyond multiple sclerosis. Metabolic issues are a huge issue. People with diabetes their risk of neurological dysfunction is exquisite, right? There's been many people who have nicknamed Alzheimer's disease as diabetes type 3. So we've got to correct for metabolic disorders. There can be inflammatory processes. So anytime there's inflammation, let's say leaky gut or diverticulitis, we've classified those as disorders of the bowel, but they have a direct impact on neurological function because they're so inflammatory. Toxicity is another issue, right? People that have severe chemical sensitivities, or they might have had heavy metal toxins, or they have a sensitivity to plastics or BPAs. We have to be thoughtful about that. People who have had history of concussions, and I happen to be one individual who's done a lot of training in traumatic brain injury and post-concussive syndrome. And I've really developed the impression that there's no such thing as a subconcussive injury. You hit your head really hard, you initiate an inflammatory response in your brain. Hormone deficiencies are prevalent. Dr. Bredesen talks about Alzheimer's disease is an insufficiency syndrome. Insufficiency of what? Well, hormones is one. Women who go through early menopause have double the risk of Alzheimer's disease as women who don't have early menopause. Women who have early hysterectomies, it doubles their risk of Alzheimer's disease. So I'm a huge fan of optimizing hormones. There's some hormetic therapies. I won't get into those today. And there's nutritional deficiencies. So I always worry about individuals who have acid reflux and they take a PPI like omeprazole, because those medicines are known to reduce levels of vitamin B12, folic acid, magnesium, selenium, the fat-soluble vitamins like A, D, E, and K. So we test for those and we optimize each of those. Now, because this is a lecture about hyperbaric, I want to show you how hyperbaric medicine folds into neurodegenerative diseases. Hyperbarics absolutely can make a difference in infections because it strengthens and modulates the immune system. Hyperbaric is totally indicated in vascular diseases. It's essential when someone has vascular problems. Because it changes the immune system, hyperbarics has a place in autoimmune disease. Hyperbaric has a place in metabolic disorders. Now, one of the complexities is if I take a diabetic and I put them in the chamber, it doesn't necessarily change their diabetes. They might have a temporary change in their blood sugar, but we've really got to help those diabetic patients better control their blood sugar while we're doing hyperbaric therapy. Individuals who have chronic inflammatory disorders, hyperbaric has a massive anti-inflammatory benefit. It can improve function of all of the organs and blood flow. So therefore, it helps to support toxicity issues. Because a concussion results in a momentary hypoxic episode. I mean, that's really the definition of a concussion. You hit your head, you have an inflammatory response, it changes blood flow to the brain, and in the very moment that you need improved blood flow, you actually have less. So you have a hypoxic episode in the brain, which leads to many of those post-concussive syndromes. So hyperbaric has a huge role in that. And hyperbaric is very much a hormetic therapy. It's kind of an extreme therapy for a short window of time, and therefore it changes the body's response through a process called hormesis, okay? So that gives you an example of hyperbarics. But I want to talk specifically about vascular disorders, and I'm going to play this brief video for you. This is a university that took individuals who are 75 years old, and they did an MRI of the brain every week for 16 weeks. Okay, so I've eliminated the sound. There's no sound of this, and I'm going to talk you through it. So the brain on the right has white matter, and scientists didn't really know what caused white matter problems for a period of time. We thought maybe it was a part of aging, but now we're starting to recognize it's a vascular issue and it's a major contributor of dementia. So they took a 75-year-old that had no symptoms of dementia, but we thought might be having tiny strokes. And so in this, they thought, we're going to MRI this individual brain every week for 16 weeks, and we're going to see if we can identify if these vascular problems are occurring, because then it helps us dial in the diagnosis and we know how to treat. So they took the technology, and this is walking through what that technology looks like. They superimposed some of the visual things to make it easier to interpret. And then they started doing MRI. So you watch week 1, 2, week 3, there was a stroke. 4, 5, week 6, no, but we get to week 7, there's another stroke. 8, 9, there's another stroke in week 9. 10, 11, 12, 13, right? We get to week 16, 17, there's another stroke, okay? So then they're going to walk through this one more time and show you how these tiniest strokes occur. But for the sake of time, I'm going to move past this. When an individual gets an MRI, the radiologist will usually put something in the report that says white matter disease or white matter hypointensities or lacunar infarcts or transient ischemic attacks. That all means the exact same thing. This is a vascular problem in the brain. And the interesting thing about that person, that 75-year-old individual that had an MRI every week for 16 weeks, he ended up having 6 strokes, but never had any symptoms. He never had any symptoms of a stroke. That's what's scary and spooky about this. So we have to be really careful about sorting people who have risk of vascular problems. So if I go back to this, remember, there's a hierarchy. There's a lot of things that can cause neurological dysfunction, but vascular is one of the top. And when people say, well, do I have risk of vascular diseases? My response to them is, well, do you have high blood pressure? Do you have peripheral vascular disease or congestive heart failure? Have you ever been told you're anemic or have edema or ever had a blood clot in your lower extremities? Is there vasculitis? I asked the men, do you have erectile dysfunction? Because if you have a vascular problem downstairs, you probably have a vascular problem upstairs, right? And if you think of all these other things like oxygen deprivation, sleep apnea, or snoring, frequent air travel, people who've been smokers and COPD, Raynaud's phenomenon, these are all clues that an individual is going to struggle with a vascular problem. Well, vascular problems very quickly need to lead to rapid aging. They cause neurological decline that's insidious. Remember, the guy that had the stroke every week didn't know he was having strokes. He didn't have any of those symptoms, but this is where people get foggy and they go to their doctor and say, gosh, I think it's just age-related memory loss. All of those can see some improvement with hyperbaric medicine. So I think that hyperbaric medicine has been a really beautiful tool that we use in our clinics to support people who are at high risk for neurodegenerative diseases. And we utilize those at the same time that we're solving all of these other problems. So it's not just like, okay, they get hyperbaric and go home. They do all of these interventions. And I want to give you a case study. This beautiful lady, her name is Lois, and she's done some social media posts with me, so she's given me permission to talk about her. Lois had some amazing results. She came to me and said, Randy, I'd like for you to help me get my driver's license back. And I said, Lois, I don't do that. I don't get people's driver's license back when they've had some cognitive problems, but I will help you get your brain health better. She took a test called CNS vital signs testing. Now, I want to point out the fact that Lois is 84 years old. I've circled in the blue box, these are parameters of her cognitive testing that were at least average or above average. And you'll see that she had 6 parameters that were low for an 84-year-old. After a couple of months of doing cognitive treatments together, I did retesting for Lois in September, and she moved every single one of her parameters from the low or low average up into the average or above average. Now, Lois is 84 years old, so she's a walking witness that you can make people's brains better. Age is irrelevant to me. I never stop trying to help people get their brain function back, and she's a perfect example that at 84 years old, when we go through the testing and the workup to find out what are her triggers or her weak spots, she did absolutely amazing, and she did it in a relatively short period of time. So I want to finish up my section by saying, look, hyperbaric made very simple is this. Hyperbaric is really a treatment for wound management, and it doesn't matter where that wound is. It's a wound of any location. And I think we've been conditioned to think, well, it's a non-healing diabetic ulcer in the foot, or it's a decubitus ulcer on the backside. But the reality is that hyperbaric is for any wound of any duration in any location, because it's going to optimize their vascular flow, reduce hypoxia and ischemic events, and suppress inflammation. So that's the part of my presentation today. I'll stick around for any questions at the end. I want to invite you to join my social media, ask questions, engage with me, and let's do everything we can to help people realize that there's so much they can do to protect their brains.
Thank you, Randy. It was a wonderful presentation. Actually, I have to thank you because you always share your knowledge and your experience in hyperbarics and in neurological field without so kind, and I have to thank you for that. Thank you so much again. As Randy said, you can make your questions on our chat, and we're gonna put it all together and try to share as we can with the speakers. Okay. Let's move forward. So with the second guest, Dr. Sierakowski. Hi, Elizabeth. How are you?
Doing very well. Thank you so much.
No, thank you again. Okay, so let me introduce Elizabeth. Elizabeth Sierakowski is a medical director for Essential Health. She's an MD and owns and practices in Essential Health. She's a triple trained in family medicine, in integrative medicine, and functional medicine. And she's gonna actually talk about the synergy between the hyperbarics and this field. All yours, Elizabeth.
Good. All right, let's get this screen shared.
There you go.
Excellent. Hello, everyone. Randy, thank you. I think there will be a little bit of overlap with our talks, but not much. And thankfully, as scientists and people who are interested in teaching, more information is always better. My particular talk will be on hyperbaric medicine as a critical tool for cognitive health and peak performance. So you'll see I'll get into some strategies and very particular clinical protocols as well. I do want to say that I am first and foremost a scientist, and I believe profoundly in the importance of wisdom and how we can keep the motor of our world running as people age and as they reach the pinnacle and peak of their career is often when they find themselves degenerating. They run out of gas, they run out of brain cells, quite literally, and they can't continue to do what they have worked their whole lives to achieve. So through HBOT and other modalities, we work to continue people and to help them be their very best for as long as possible. I do want to thank Mira and Biobarica as well for hosting. I don't have any financial interest to disclose. I do own and operate a Biobarica Revitalaire in my private practice, and so does my partner, Jay Stevens, in our other location in the Triangle. We are in Raleigh, North Carolina, and we have a couple other locations who license our brand and intellectual property across the country. So we're honored to be here today. I'd like to start with a little more information on the brain and brain injury, not just decline and dementia. So we're going to go through some root cause from a functional perspective and some learning there, and then I will move into hyperbarics and how it can be used for all of these, similar to Randy's talk. It's traumatic brain injury and dementia collectively are individually, they are already a major cause of death and disability worldwide. Collectively, they are the major cause of death and disability. And what we'll see is that I think it is grossly under-recognized. As people have head injuries, they think nothing of it if it's small. They think they have to pass out, they have to go to the hospital, something untoward has to happen immediately in that moment for injury to have occurred, and that is simply untrue. These traumas, the brain keeps the score, the body keeps the score, as they say, both physical trauma and psycho-emotional trauma. So we'll go through some of those as well. I want you to notice in these categories here, we have more of the cellular aspect of injury and how that can occur. Neuroinflammation, toxic proteinopathy would be like beta amyloid plaque with Alzheimer's. Mitochondrial dysfunction, we hear more and more about in the past few years. Functional impairment, cellular death, excitotoxic injury, and structural injury. There is more, but in each of these, we can break them down into each of their individual components. And this part's a little more for the clinicians, but if lay people have questions, please put them in. Cytokines, chemokines, we hear about cytokine storms and histamine damage, reactive oxygen species. Why antioxidants get so much attention in the supplement world and elsewhere is because we are in a profoundly pro-oxidant environment and a profoundly toxic environment, which impairs our mitochondria and their ability to do their jobs. Cell death and structural injury can be very specific. That can be something like I had a physical trauma to the head or a chemical or other trauma that have resulted in axonal degeneration. So we can see the myelin sheath that functions like insulation for the nerves can degenerate, or we can see the actual little tails and fingers of the nerves become clipped and shortened in a very physical sense. And those can show up on brain imaging. And I have a really cool image to show you later regarding exactly that. Excitotoxicity is something that I have personal interest in. I'm a primary care physician to start, and I have many more attention deficit patients now than I ever did in my career. I do believe that excitotoxicity, reactive oxygen, but also lipid peroxidation and calcium influx, along with glutamate and seed oils, things from our environment and our foods, are creating an acid and excitotoxic environment for our brain cells. And there are very particular methods that we can reverse that as well. Functional impairment would be more like network dysfunction. So impaired regional connectivity. Can this part of my brain talk to that part of my brain, even if the individual cells are still intact? And all of that is in addition to genetic and epigenetic changes, ischemia, edema, swelling, necrosis, cell death, and blood flow dysregulation, which, as we saw clearly in Randy's talk, is happening all the time, even if someone didn't have overt symptoms of a stroke. So to highlight again, neurologic disorders collectively were the leading cause of disability life years and the second leading cause of death in the whole world in 2016. Cognitive health awareness. This is something very profound to me. I have done a full advanced fellowship through the Academy of Anti-Aging and Regenerative Medicine, otherwise known as A4M. And I love I also a member and have done work with IFM, and I love the emphasis on education and updated information. And the last lecture that I went to really brought forth the importance as we work. I have a lot of CIRS patients, chronic inflammatory response syndrome, and it brought forth this neurodysregulation concept. where we know that the fight or flight system is outweighing the rest and digest system. In a primal sense, our bodies are supposed to be in that 80% rest and digest system. 80% of the time in the rest and digest system. And I know no one in my life who is there all the time, unless they live in the woods and do only yoga. Most of us, as we perform and function and drive through our day, are 80% in the fight or flight system. And what happens as we get that cortisol internal steroid signal in over and over and over again? We've heard about HPA axis dysfunction. We've heard about adrenal fatigue. That term is outdated at this point, but it brings home the idea that we are burning out. We're burning through our cells, our energy, our mitochondria, our nervous system, and it is impairing our ability to utilize nutrients correctly, digest our food correctly, and in effect, we get into a cycle of making our problems even worse. The trifecta of neural dysregulation would be a traumatic brain injury, PTSD or trauma, and biotoxin exposure. So what I want to really ring home for the clinicians in the room and for anyone who is caring for themselves or a loved one is that between TBI, trauma, and biotoxin, everyone has some level of brain injury. Everyone. There is none of us have escaped all of this. And what's so profound about hyperbaric medicine is that it addresses each one. So we're going to yield a reduction in inflammation with TBI specifically. We have great evidence. Again, I'm going to show you some PET scans later. Hyperbaric medicine is in fact antimicrobial, and it reverses hypoxia, and it reduces inflammation, and it corrects that acid-base balance to stimulate mitochondrial function. So it is an antidote to biotoxin exposure. It is also an antidote to PTSD trauma. I found an amazing article, which if anybody is interested afterwards, I can pull the articles that I got this information from, and I'm happy to share. But HBOT superior to pharmaceutical medication in sexual trauma cases. And that is profound information. I do want to talk through the mechanism of efficacy. So how hyperbaric works, oxygen in tissues. In fact, I'm going to move this little screen so I can see my notes better. Oxygen in tissue moves down a pressure gradient, and this is the core of how hyperbaric medicine functions. The gas oxygen comes in through inspiration. It goes through the alveoli, into the artery blood, down into the capillary beds, out in our fingers and toes and skin, through the interstitial fluids between cells, and then into the cells and target tissue and mitochondria. And that gradient is dependent on gas pressure. So when we increase just oxygen, if somebody sat at room air, as they say, and then we added an oxygen mask, a little bit of difference would happen, but not much. The secret really is in the pressure and how much pressure. So we'll get into that as well. And it does explain the difference among different types of hyperbaric chambers. We like to talk about depth, right? So we talk about atmospheres, but when I talk about it with my patients, we go through, for example, the Revital layer goes to 1.45 atmospheres, and we talk about it being about 16 feet deep. And people can get an idea of what that feels like. They know what it feels like to swim to the bottom of the pool and have a little pressure in their ears popping. That pressure plus the increased oxygenation that we're breathing is the secret to how hyperbaric medicine works, by forcing that tissue gradient. The other piece that's really important here is that the hyperoxia stimulates collagen, leukocyte migration, capillary matrix, reduces reactive oxygen species, reduces edema, and the intermittent hyperoxia and relative hypoxia, which is us at room air, is by nature the intermittent. We're not living in the hyperbaric chamber, right? So you're in sometimes, you're out sometimes. That wave between hyper and hypoxia is what is actually creating and stimulating the change in the body. Living bodies do best with pulsed change of all kinds. We think about circadian rhythm, we think about hormone pulses, we think about peptides and how we use those. The same thing is true for hyperbarics as a hormetic effect. Hormesis being, people talk about the what doesn't kill you makes you stronger, which I wholly disagree with, by the way. Things that are really damaging to your body can in fact make you weaker and sicker in a prolonged fashion. So what we're trying to do here is just hit that threshold into the growth and change zone. We're trying to stimulate your cells, stimulate your mitochondria, stimulate your fibroblasts, change the leukocytes, change the cytokines just enough to create a healing milieu, but not so much that we tax your system. That is why there is an upper limit to hyperbaric. There is an upper limit to all therapies. Nothing more is not better always. The intermittent flow is what we're trying to go for here. I also brought up, based on that first slide where we had the 6 different categories, I brought up here specifics for how hyperbaric addresses each category, most of which I have talked about. The increased BDNF I found profound as its own self, so brain-derived neurotrophic factor. We are, in fact, driving your internal pharmacy to make more of the very specific chemicals that you and your brain and your tissues need to be your best and most optimal self. And that is why I love functional medicine and integrative as a root cause approach, because rather than the Western concept of what are your symptoms, what is your diagnosis, and what is my treatment for your diagnosis, instead, what is the imbalance? What are all of the factors, like Dr. Dale Bredesen, and I love that book, the 32 holes in the roof, right? What are all of the pieces? And if we can do our best to fix and repair and heal from the inside out, that pyramid of health improves no matter what your diagnosis is. So when people call essential health and they say, do you treat Lyme? Do you treat MS? Do you treat pick your poison? The answer is I treat people. I treat people with whatever they come with. And we see improvement always. And I love having the advanced tools to do so. So we'll move into clinical evidence here. And this is that PET scan that I showed you. I found this profound. And for people not used to looking at it, what I want you to notice is how full this area appears here, here, and here after 39 hyperbaric treatments compared to, and now you can start to notice, if you're not used to it, all the little holes, all the holes. So these are all of the places on this person's brain who had had a profound TBI, he was military. And these are all the places without enough blood flow. So there's true hypoxia. And if hyperbaric or other intervention had not happened, these would be areas of cell death and brain loss. So in this case, with this SPECT imaging, we know that hyperbaric works because that was the only treatment this guy had. There was nothing else. There weren't drugs, there weren't supplements, there weren't any other things. He lived his normal life. They just had him in the hyperbaric chamber a lot. This was 39 sessions in 26 days. So again, I'll show you a little bit later, but it works. And that I found profoundly cool. Other things that we know it works, right? Because you always like to ask, back to being a scientist, you can ask the patient all day long, but patients want to get better. Sometimes they will tell you they feel better, and maybe they do a little bit, but I want objective evidence. I want to be able to show my colleagues that hyperbaric is worth doing. So we have objective imaging here. We have many studies with blood tests showing improved antioxidant markers, improved anti-inflammatory markers, lower inflammatory markers. And then what I also found the most important, as a patient, I care most about how I actually function at the end. I don't really care if my blood markers are better. That's cool, Dr. E, but I still can't think. I still can't drive. I still can't, organize all the things I have to organize in my life. So I care most about, at the end of the day, can my patient perform better, feel better, live more life because of a therapy that I have instituted. In this case, again, with hyperbarics, we know that that's true. Significant improvements for cognitively impaired patients at 1 and 3 month follow-up. So this is not just, I put them in the hyperbaric chamber and they got better for a little bit, they stay improved unless another injury happens, which again, per our previous conversations, we know is happening all the time and every day. But unless something large happens, someone's going to maintain the benefit they got out of hyperbaric for a long time, which again, profoundly awesome. So we have many mental status exam, Montreal cognitive assessment, activities of daily living. I also use the CNS vital signs cognitive assessment in my clinic, and we love it for that objective and internationally validated. It comes in many languages, so we can use it everywhere. Ultimately, hypoxia, not enough oxygen, drives neurotoxicity and cell death. And hyperbaric oxygen creating hyperoxia reverses it. It is non-invasive, it is safe, and it is effective. So why would we not do hyperbarics on absolutely everybody? And the answer is, I would. I would. But it comes down to time, money, decision, and coordination fatigue. So I like to be very honest and open with my patients. There are 8 million things in the world that they can do. Why would I pick this therapy for them? And what do they expect to get out of it? So again, our patients are coming to us for trust, ability to help them allocate all of their resources effectively. So to increase their observable success rate and yours, we're picking and choosing therapies that are going to be the most profound for that patient. I do use HBOT often and in many, many, many people if they can do it. I'm also working on a home program where I can get HBOT into people's houses where they're more likely to do it on a regular and daily basis, which will help. So we get creative. I'd like to move into strategies and protocols. This particular study was level 1 evidence-based med criteria and class A recommendation for persistent post-concussive syndrome. This would be an intensive protocol. So we're looking, most of these you'll see, I tend to recommend 1.5 or 1.45 atmospheres. I have a revital air, that's what it goes to. So I will use that most frequently. Hospital-based hyperbaric chambers will go to 2 atmospheres or beyond. But at those, we know that there is negative benefit if you go much above 2 atmospheres, the pressure is too high. So while you will get an increased oxygen gradient, you will also get things like ruptured eardrums, and nobody loves that. Symptomatic and cognitive improvements were achieved with 40 dives at 1.5 atmospheres or 30 dives at 1.3. And you'll notice, so, do I need to do 40 at a higher pressure if I can achieve benefit with fewer dives and a lower pressure? Again, it comes back to time, resource, what is available to the patient, and how intensive are their symptoms or injuries. More is better, frequent is better. That doesn't mean that less is useless. So I remind my patients, some is better than none. More and more frequent, you will get more out of it. And we do the best that we can with their schedule and their resources. Protocols are highly personalized to individual circumstances and needs. So at least in essential health, I don't recommend fewer than 10 dives. If they're doing a couple on occasion for generally enhanced performance, fine. But if they have an injury or brain injury specifically, 2 to 3 dives is not going to show them benefit. So I don't want to set them up for disappointment if they do 2 dives and nothing happens. So I remind them, this is about tissue healing, and that takes time, but we're going to give your body and your brain its best effort to do so. This particular study I'm extra proud of. Dr. James Stevens is our co-founder for Essential Health and my colleague and dear friend. So I wanted to highlight that he has been published in hyperbaric medicine. He's been doing hyperbaric medicine for many, many years and is a wonderful friend and resource for all of us in Essential. In this particular case, it was related to acute sport-related traumatic brain injury. So similar to post-concussive, but rather than a prolonged post-concussive syndrome, this was I got a head injury, coach pulled me out, what do? I want to play the next game. And it's 60 minutes, 1.5 atmospheres, 5 sessions within 10 days of concussion. So this gets back to, you've got a student athlete and they're going to school, and how do you coordinate them coming into the clinic? You do the best you can. So rather than saying, nope, you have to come 5 days in a row, they don't necessarily. We can get 5 sessions in within 10 days. They're going to have improvement. So that was a profound article that we enjoyed. Mild cognitive impairment. So back to protocols. This one is so interesting. Mild cognitive impairment can mean many, many things. This can be objective or subjective, meaning someone says, I just don't feel as sharp as I used to, even if every test that I do looks normal. I still believe them. They don't feel sharp. What else can we do? So for example, I've got a dear patient of mine who is a female in her 60s. She is ApoE44 with a strong family history. And she had profound CNS vital signs improvement after the addition of hormone therapy, along with specific and targeted nutraceuticals, some keto flex. And we support her intermittent episodes of mild cognitive impairment with HBOT. So she is someone who doesn't come all the time because she can't, but when she is having a hard time, we put her in the chamber and she notices improvement. And that, again, is everything to me. The studies talk, again, most of our studies are going to point to data and evidence that are many more dives because people are involved in a study protocol. But out in the world, I wanted to share that this works even if someone can't do 60 dives in 26 days. Most people are not doing that out in the world. 2 atmospheres, 90 minutes with 5-minute air breaks every 20 minutes. So you can imagine, again, in a clinic setting, this would be difficult. You're diving and pulling in, pulling out, pulling in, pulling out. That is a lot of clinical time as well. So it does work, but so does 1.5 atmospheres for an hour, 3 times a week. We're also developing some more protocols on 90-minute dives. I don't have people dive for longer than 90 minutes, or sometimes we'll do a double, back to that hyperoxia, hypoxia. We'll do an hour, 45 minutes, take a break for 45 minutes to an hour. A lot of times we'll couple that with IV therapy, put them back in the chamber for 45 minutes, and they can do that fewer times a week. So if it's difficult for someone to get to the office, they come in, we do a more intensive protocol less often. Or if it's easy, they come, they get in for an hour and they head out 5 days a week. Performance enhancement is another fun one. So back to my brain works fine, but I want it to work better. Now, what do we do? So I'm in this camp right now. I'm in my late 30s and I want to perform at my peak all the time. I run a business. I've got a 2- and a 4-year-old kid at home. My husband's an entrepreneur and we go all the time. So I need this brain to stay on. I do my ketones. I'm on a Prolon fast right now, which is actually, I was a little nervous that I would pass out, but I feel great. I love ketosis. It's wonderful. And I get in the hyperbaric chamber. I try for once a week. That's about what my schedule allows. I stay in for longer. I do the 90 minutes because I'm there. I might as well get a little bit more out of it. And I tend to do breathwork exercises while I am in there. Not something as aggressive as Wim Hof. You don't want to hyperventilate while in the chamber unless you are being monitored, please and thank you. That would be next level biohacking. But at a basic, I will do very slow breaths to make sure that I am in that rest and digest system. We know that if you slow your nasal breathing and slow it down to about a 5-second inhale, 5-second exhale, you're going to get about 6 breaths a minute. And that triggers that primitive lizard brain to pop you into parasympathetic, improve heart rate variability, improve nitric oxide synthesis, and you'll get more benefit out of your hyperbaric experience. So I try to recommend for people, even if they are distracted doing other things, remember that you're here for therapy and get the most out of it while you're there. So for performance enhancement, once a week seems to be effective, but there was this very cool study on a 90-minute dive while they were doing the critical thinking and performance during the dive. I have certainly run meetings and done things while I'm in there, and I do find that executive functioning is easier. That's pretty fun. What is on the horizon? So the future and the frontier of cognitive performance and longevity, I think there will be more and more evidence, more and more imaging will become available to people who are not in a research study. We know that there's more data on telomere length and aging, decreasing immunosenescence, aging cells, stimulation of stem cells, which we know hyperbaric chamber does. In fact, it mobilizes stem cells from bone marrow, which is profoundly cool. But it is the healing of the unknown injury. So I hope that we are moving into a frontier where we don't wait to be sick, wait to be overtly injured, that we move into this preventive mindset, understanding that the world around us is already toxic, understanding that our bodies are doing their very best for us every day. I am firmly team your body. It's working for you, not against you. So if your body feels like it's failing you, then that is a great time to pull in a functional medicine expert and say, I don't feel well. I know my body's trying to help. How can I help it do its best? We're, again, Wim Hof breath methods, I think overlapping hyperbaric with ozone and EE.UU, which we offer here as well. IV therapy, neural therapy with procaine is gaining in popularity, and we're having profoundly wonderful experiences with our patients here. Being able to stack therapies and get access to more and more people, that's the frontier of longevity and performance in my mind. This has been a pleasure. Thank you all.
Well, thank you so much, Dr. Sierakowski. It was an impressive presentation and very useful, actually. Pretty related with Randy. I think it's a perfect complement for the another component of the neurodegenerative and functional medicine. Thank you so much.
Thank you.
Good. Let's follow with our next guest, Dr. Chris Pepitone. Dr. Chris, how are you?
Very well. Thanks for having me.
No, my pleasure. Okay, let me introduce our next speaker. Dr. Chris Pepitone is the owner and chiropractor of Pure Health Services. Dr. Pepitone is also certified SOT chiropractor and sports chiropractor. Chris, you can share your screen anytime. Just let me. I don't see you now. Okay, there you go. Perfect. Thank you.
Okay. Thanks for having me, everyone. So my presentation is mostly going to be about what's been coming into the whole longevity world, where people are utilizing adaptive physiology in order to try to. The idea would be living longer and enhancing your quality of life. Now, I do find that there's a little bit of misunderstanding. So I kind of emphasizing like what does the stressors do today for the body, and really how to properly use them so that you don't accelerate aging, that you can actually more so, it's about health span and compressing morbidity. So what we want to do is we want to live as long as we can, as healthy as possible. And then when we're going to go, just nosedive and then let it be done, or just die in your sleep, right? So before we begin, I just want to kind of describe like what is really actually aging. Now, aging by and large is going to be a functional decline of the biological processes, including dysregulation of mitochondrial metabolism, cellular function, tissue failure, and body function. Now, this is when you start getting exposed to different stressors in life and you're ill adapted to those stressors. The body starts to break down, and this is where symptoms and weaknesses and immunosuppressants and stuff like that happens. Your stress responses are going to rapidly will shape your aging process. Some definitions I think are very important to understand when we're talking about aging and really utilizing adaptive stressors. One is stress resilience. Now, this is when you get exposed to a stress that how well and how quickly your body bounces back from that stress. And when it bounces back from that stress, that's through the adaptive processes. And in doing so, the system that is stressed and bounces back actually becomes younger compared to baseline and more functional. Physiological reserve. Now, this is a really important one because this is very individual dependent, right? So how much stress can you tolerate before it becomes a destructive stress or an overstress? That's something that when you're dealing with things like, more importantly, like sauna and ice baths, that's where this becomes very challenging for people, that they think they're doing better by doing more. Now, when it comes to overstress, when you exceed the ability of your body or your systems to cope to that stress, what you're actually going to do is cause a destruction to that system, damage, cellular death, and a stress acceleration of aging. This is something that we want to really do avoid. And this comes through pushing through stress resistance. So when we're talking about ice baths and saunas, oftentimes people think the more is better. Now, when you develop stress resistance, what that really means is that you require a greater dose in order to stimulate that same adaptive response that you did when you first started doing it. So oftentimes what you see, especially with ice baths, like I mentioned, is that people start pushing their times. Now, typically speaking, 3 minutes is skin cooling. Beyond that is core cooling. You're not trying to induce hypothermia. Hypothermia is an overstress, and that's the thing that's actually going to cause damage to the systems. And then we have frailty. The best way to describe frailty is ultimately a condensed form of physiological reserve that shrinks over time. So when you have that elderly person that gets hit with a cold gust of wind, then what will happen is it becomes immunosuppressive to them, and they can develop pneumonia. Now, understand like the madness of that, right? Where they get hit with a cold gust of the wind, and a bacterium that's already in the lungs is able to now take hold and threaten their life. This is something that, in my mind, is really unacceptable. Now, this is a stress response curve. And as you see here, the most optimal for hormetic stress is really ideal exposure, which is the green phase. Now, what will happen is if you keep increasing your stress resistance, you start pushing that green spot right there over towards the right. And then you start risking an overexposure or toxic stress. Now comes into the hyperbaric oxygen therapy. This by far, I would say, in my opinion, is the most valuable therapy to initiate or really just to have in your life in general, but also to initiate when you're going to start exposing yourself to other environmental stressors, because it's going to prepare the body by enhancing physiological reserve. They do this because every stressor, what it will do is it stresses the mitochondria and the central nervous system, right? So when you do hyperbaric oxygen therapy, what you're doing is you're stimulating mitophagy and then preparing the body to handle more stress, therefore enhance or expand the physiological reserve. Now, the one thing that oftentimes sometimes is overlooked is the first 1 to 5 sessions, depending upon the person's physiological reserve, can actually be some damage because it's going to significantly increase reactive oxygen species production because you're making the mitochondria do more work. But the reaction to that is an upregulation of the antioxidant systems. And that's where one of the values of this comes in. Now, once you pass that 5 session, you're going to start seeing, and at least this was in the data, that you start seeing an absolute net benefit, right? After you see that 20 to 60 range, that's when you're seeing pure benefit, no excess inflammation. And that's really where I think the longevity world needs to go, is like that. Well, the longevity series that was expressed in the Israel study. Okay. As mentioned before, what you're going to get out of the adaptive response for hyperbaric oxygen therapy is the upregulation of the antioxidant systems, increasing mitochondrial biogenesis, partial or whole mitophagy, and increasing sirtuin production. Sirtuins are great because they're going to be part of the regulatory process for cell death and also cell regulation, and they help with adaptive physiology as well. I'm a big fan of the idea of dose matters, right? So the dose that you choose dictates the outcome you are going to get. However, this is also basically what you're going to be seeing is mild pressure, medium pressure, and high pressure for hyperbaric oxygen therapy. I personally have a Revitalair chamber as well through Biobarica. For me, like it was previously mentioned, I think the neurotoxicity and barotrauma risk of reaching above the 2.0 is not always necessary, and oftentimes it's just not worth the risk. Now, the adaptive outcome of hyperbaric oxygen therapy, we're going to see lengthened telomeres, and that's going to be reversing the biological age. What they found with mitochondria is that when they become dysfunctional, they go hypermetabolic. And that hypermetabolic process is actually what shortens the telomeres. So when you stimulate through mitophagy and mitogenesis, brand new and many more mitochondria, you can actually lengthen the telomeres that way, or the mitochondria actually do that. And then we have all the things that have been mentioned in the past, including stimulating osteogenesis and bone repair, increased ATP production or more energy, and so much more. All right, now we're moving into intentional cold exposure. So the stress reaction here is going to be cold stimuli. This, again, is going to increase reactive oxygen species production through stressing out the mitochondria by making them do more work in order to generate heat. Now, the adaptive response is kind of cool, where what happens to the mitochondria is that they actually change their shape. So they morph from ovoid to spherical. This is actually what this creates is a proton shift in the gradient, where what happens is that instead of generating ATP, the mitochondria start generating heat. This is what's deemed as non-shivering thermogenesis. This is really kind of like where it begins to become the benefits of cold exposure, is when you're going to start stimulating mitogenesis in white fat, or otherwise known as browning of white fat. So the more brown fat you have, generally speaking, is absolutely better. Now, the interesting thing I found in the data was that within 15 days of no cold stimuli, all of the brown fat that was converted, or we'll call it beige fat, gets converted back to white fat. So what this tells you is that it's important that whenever you're going to be using environmental stimuli to stimulate the adaptive response and promote like health span and longevity and whatnot, what you really need to do is consistency is king. So keep stimulating and keep like for the adaptive response, so the body keeps regenerating and it creates the need for it. Okay. Now, again, for the doses, one of the main things that like the data points that people talk about is temperature and time. Now, the temperatures, if you compare for the benefit of a 530% increase in norepinephrine and a 250% increase in dopamine, In order to accomplish that, if you compare 40 degrees to a 50-degree cold plunge, you have to be in for 2 minutes versus 1 hour. Now that's a massive difference in order to accomplish that same benefit. And I would argue that 60 minutes in 50 degrees could potentially induce hypothermia in a vulnerable individual. So it's better to do short stints in colder water than long stints in slightly warmer water. Now, the one thing that I found in one of the studies was that in order to optimize gene expression for cold exposure in brown fat, 39.2 degrees was the most optimal temperature for maximal gene expression. Now, the adaptive outcome for cold exposure is brown fat activation and conversion, and that actually happens through the norepinephrine and dopamine spike. So dopamine and norepinephrine actually are what begins the conversion of the brown fat stimulated. You're also going to get a boost in immune health through antioxidant production, T cell activation, and also natural killer cell activation. It's going to reduce inflammation, improve circulation, and through the brown fat, it can increase metabolic rate up to 16%. Now, just a little bit about brown fat. Now, what you're going to get here is you'll see in this, and this is oftentimes when you see people guiding them through cold exposure and through the process, if they are overweight, they'll start saying that first is they will lose weight, their waist will shift. Their weight might not change immediately, but their fat will feel different and it will move different. And this actually is because the lipid droplets actually change in size in order to be more functional to be used as energy by the mitochondria. Now, a cool thing about brown fat is that it actually makes a ton of hormones. So it makes thyroid hormone, nerve growth factor, which again, here, as you see here, it promotes survival and proliferation of neurons. VEGF-A, which protects against diet-induced obesity and metabolic disorders, which is also another thing called nutristress when you overload with fats or carbohydrates. Neuroregulin, which inhibits fat generation. Fibroblast growth factor, which can contribute to correcting obesities and improving metabolic homeostasis. Bone morphogenic proteins, including BMP7, which stimulates mitochondrial biogenesis to promote the browning of white fat. Now we move on to the infrared sauna. Now, it's always important, I feel, to understand exactly what something's doing so you understand that when you need to stop. Get your dose and get out, right? So infrared sauna, what you're really doing with an infrared sauna, and even a sauna in general, is you're heating the water inside of the cell. Now, yes, this will increase the reactive oxygen species production, which, as you can see, this is a theme amongst the stressors, but it's going to cause damage to the proteins and the vesicles and the mitochondria in the cell itself. It's going to inhibit the mitochondrial ATP synthesis, which results in dysfunction of the electron transport chain. And it's going to cause misfolding of the mitochondrial membrane proteins, creating transition pores. Now, this becomes an alert system mechanism for the cell, where the mitochondrial DNA will leak out and create an inflammatory cascade inside the cell. This will cause a lockdown of the nucleus, and actually one of the mechanisms that people become chemo-resistant is when the mitochondria leak out their mitochondrial DNA into the environment, and then the chemo can't get into the nucleus. Now, the adaptive response to infrared sauna is a calcium influx into the cell cytoplasm and the mitochondria. You're also gonna, if you overdo this, the stressor, it's gonna stimulate apoptosis through mitochondrial action and therefore cell death. You will also, within 4 to 6 hours post-heat exposure, you're gonna get heat shock protein production. Now, this is an important one because the small heat shock proteins, what they will do is they actually clog the pores that are the transition pores in the mitochondrial membrane to inhibit the leaking out of the mitochondrial DNA. So if you can do it in a dose-sensitive manner, what you can do with the production or the repetitive production of heat shock proteins, you'll get the minor damage to the proteins, heat shock protein production, which then is going to regenerate all the proteins and the vesicles inside the cell, but it's going to stop the excessive inflammatory response by clogging up the pores, the transition pores in the mitochondrial membrane. Now, another one product that's going to produce is MMP1. This is going to stimulate breakdown of the extracellular matrix for tissue remodeling and protection at mostly the skin level. And it will increase nitric oxide and nitric levels in the bloods as well. Dose dependent. Now, there's not an immense amount of data on the dose for infrared because it's been kind of a more fairly new thing. There is a therapy called WAN therapy out of Japan that they've been doing some great research with 140 degrees for people with congestive heart failure and other cardiac conditions of that nature. What they're doing with that is 15 minutes at 140 degrees, and they're lying them down for about 40 minutes under a blanket to keep the body warmed. Now, you have to keep in mind here, that's a frail individual, right? So someone that's frail, I would definitely recommend a little wand therapy. What I found personally through the data that I'm tracking with myself, 147, which is really 145 to 147, seems to be the sweet spot. If I exceed it to 150, I will find a dip in my heart rate variability the next day and much more exhaustion, which is definitely a sign of an overstress. So I don't do that. But the key is increase your core temp to about 3 degrees and then get out. Otherwise, overstress to the system. As mentioned here again, low dose stimulates the protective mechanisms versus high dose or too high of a dose can damage the organelles, cells, and the mitochondrial DNA as well. Here's some benefits that you're going to see with infrared sauna. It's pretty amazing stuff. My big thing is basically heat shock proteins and heat shock factor, as heat shock factor 1 has been tightly coupled to lifespan for its ability to protect the cells against diversity of pathogenic insults as well as environmental insults as well. All right, fasting is another one that's becoming a lot more popular that people are using sometimes incorrectly. But in general, what it's going to do is it creates nutrient deprivation and a shift of fatty acids to the oxidation, which is going to, again, increase reactive oxygen species production. Now, the adaptive response, again, from the mitochondrial standpoint, is actually mitochondrial fusion. So in order to preserve energy and reduction of reactive oxygen species, the mitochondria actually will become fewer in number by merging or fusing, and they become slightly larger. This gives the mitochondria an opportunity for partial mitophagy, where because they have to reorganize the internal structure in order to really function, and because they became one from two, so to speak. And this helps stimulate repair of the internal mechanism of the cristae and such. This will improve mitochondrial oxygen utilization and also increase ATP production. They found that fasting also increases intracellular NAD levels, browns white fat, and stimulates mitochondrial biogenesis. Now, back to the dose matters. A little is good. A lot is actually better with fasting, but there's the individual needs. So someone that's really, say, petite or small person should not be doing extraordinarily prolonged fast, because then you're kind of teetering on malnourishment. But these are some examples of fasts that people do. Time-restricted feeding, 48-hour fast, intermittent fasting, which is typically defined in the research as alternate day fasting and 5 on, 2 off. 24-hour fast, 36 hours, 10-day, 2+ week fasts, and fasting mimicking diet, which can be applied to all of them. I'm a big proponent of the fasting mimicking diet, simply because when the longer you prolong a fast, in every study that I've seen pretty much, the longer this fast that's a water fast, the more hospitalizations due to cardiac arrest, due to basically it's electrolyte imbalances primarily. Fasting mimicking diet, what that allows you is vegetable broth. Some people use bone broth, but vegetable broth is usually the preferred. As long as you keep your calories under 250, you're still in a fasted state. You reduce all of the risks of the water fasting, and you can prolong the fasts and get significantly more out. Now, adaptive outcomes for fasting. We're seeing cancer protection. It can remake the intestinal microbiome. It will enhance mitochondrial biogenesis and energy metabolism gene expression. It reduces oxidative stress and inflammation, tissue modeling, DNA repair, enhances metabolic flexibility. Now, the MetFlex is a big thing because that ultimately is where you're going to be dealing with diabetes, insulin resistance, and things of that nature. So you can actually improve those markers with that if done with the appropriate time frame. Shorter fasts, you'll have momentary benefit, but then once you go back to the refeeding, all the markers start coming back. So that's where prolonged fasts really tend to thrive. All right, and then finally, mixing the stressors. So you're going to start with hyperbaric. I do this because, again, it's going to improve the physiologic reserve volume, which then allows people to handle more stress, to activate more pathways for rejuvenation. Because if they're really frail, you can't really activate as many pathways because you can't take as much of a dose for that individual. So if you start with HBOT, you're starting from light years ahead, and then you're in a lot better situation. Now, as you notice, all of the stressors one of the things, the common elements is they impact the mitochondria and the central nervous system. So dose intensity and frequency are very important for the outcome. Too much stress is destructive. Too little just doesn't do enough sometimes for what people deserve to get. This is based on, again, on the individual's physiological reserve. My general rule of thumb is if you need a nap at the end of the day, you pushed yourself too far, right? So now just to kind of recap on as far as applying all of the stressors and kind of working together with them, there's three things that will brown white fat. One is fasting, another's cold exposure, and the third is exercise. So if you're going to optimize brown fat, and that's the goal from cold exposure, you may not need that full 11 minutes that you'll see sometimes circulating in the research or ultimately on social media, that you might be able to reduce the number of minutes per week because you're implementing fasting as well and utilizing the fasting to keep the brown fat activated. That's basically it for today. I know I threw a lot at everybody, but thanks for having me and I appreciate the time.
Thank you, Chris. Again, it was a wonderful presentation also. Actually, the three of you, incredible presentations. I have a few things to tell you to all participants. The first thing is, and actually is a question that I see on the chat many times, is what about this material? So all this presentation is gonna it has been recorded and it's gonna be posted on our platform, and we're gonna share it to your emails directly, so you will have it probably in next week or the other one, but definitely you will have all the presentation recorded for you. Okay, so don't worry about it. So we have a few questions. Some of them, the participant made it before the event because we shared the opportunity to make some questions to the speakers regarding the subject and their specialty. I'm going to start with one question here for Chris. And actually, I saw the answer in your presentation, but if you can focus on the question and answer for the participant. So, how often to use, hyperbaric chamber, and when during the training week does it work best? And how best to combine with other modalities like red light, sauna, cold, and others?
So I like to start people with, usually I get them past the 5th session for the hyperbaric, or that's my recommendation. Some people are very excited and they just want to get into it. So I kind of make sure that if they're going to do the hyperbaric, the first 5 sessions, try to make that the only stressor that day. What I have found is that if you do more than 3 stressors in a day, it tends to be too much, where then you're just going to feel exhausted by the end of the day. And then if you end up falling asleep, taking a nap on the couch, you went too far, right? So I usually go with the longevity series, just from the data. Basically, after that 60 sessions, you see a plateau in the benefit. And once you get someone, if you stick with the 3 times a week for 60 sessions across that, that 20-week window scenario, you're kind of tired. And then you'll be able to fill yourself up with a lot of other stuff, like incorporating more exercise. You can do more, you can do more sauna and things of that nature, but too much is too much. So I'll give you an example. I had a patient who's early 30s and he does everything. He ice baths and saunas every day, HIIT training 3 days a week, resistance training 2 days-ish, and cardio interspersed throughout. And I was like, that sounds great, but when do you recover? And he's like, well, I ice bath and sauna. And I'm like, well, they are considered recovery tools, but they're still stress. And I asked him, I was like, I'd be curious to see what your heart rate variability is at. And he's like, I have a Whoop, but I don't wear it. I'm like, I would put it on. The following week he comes in and he's like, I'm depressed. I'm like, what's going on? He's like, my heart rate variability is in the teens. I'm like, well, you tanked, right? So now you have to recover. And this takes a little bit of extra time to come back from that level of really, you think you're doing so good for yourself, but really you're just overstressing your system. So again, just to recap, I would say I usually wait 5 sessions so that the antioxidant system can kind of catch up a little bit. And then I start implementing other stressors. So usually what people will do is they do hyperbaric, sauna, then ice bath. I try not to do the ice bath and then the hyperbaric, simply because if you're still cooled, because with an ice bath is different than cryotherapy, where when you get out of cryotherapy, you're warming up immediately. Ice bath, you're going to be still getting colder for the next 20 minutes approximately. So if you've stimulated a morphology shift in the mitochondria to change to thermogenesis, you're not going to use it to make as much ATP. So the first 20 minutes, it's a modified benefit, right, in the chamber. So I usually opt for ice bath after that. And what was
Perfect,
there was
got it.
another part of that question? I forgot what it was.
Yeah, that's yeah, perfect. Good. I have another question. Thank you, Chris. Randy also was helping us in the chat answering some questions, but Randy, I had one here that you already answered, but I want to share it with all the participants here. So regarding epilepsy, so you already answered. Can you explain a little bit more about that?
Yeah, so most neurological pathologies start with a neuroinflammatory problem. And conventional medicine is phenomenal at parsing out the details and the symptoms and then coming up with a diagnosis. But oftentimes that doesn't get us any closer to what's driving this problem. So in epilepsy, it's clearly a neuroinflammatory problem where the gating of the neuron changes, and an individual's voltage at that neuron is too close to threshold and it's very quickly going to fire. That's often a mitochondrial problem because we've got to be able to pull that threshold back down, repolarize a nerve and so that it's a little bit healthier. So oftentimes, not always, but oftentimes in pediatric epilepsy, there's a hypoxic event that may have happened at birth, or there was a childhood injury. When I see seizure disorders in adults, it's oftentimes associated with a traumatic brain injury or a concussion. And so my response is that those pathologies are manifestations of neuroinflammation, and my approach doesn't change. You still have to work through all of those potential triggers and try to identify what's driving this process, and therefore how do I mitigate it or treat it.
Thank you, Randy. Thank you so much. Dr. Elizabeth, I have one for you here. They ask, does hyperbaric oxygen therapy boost immunity? Can be used in wellness center, or is it mainly for sports recovery and patients with certain conditions? Or in a different way, how can we market it for normal patients with no certain condition? I mean, people seeking overall health.
Absolutely. I use that in my practice for that purpose now. Yes, it is beneficial, specifically talking about the immune system and overall wellness. We know that the hyperoxia and intermittent use with hyperbaric oxygen therapy at a lower atmosphere. So I would not be using a 2.0, 2.4 atmo for general wellness. A lot of times you'll see the soft chambers, the 1.3 atmosphere ones. A lot of times those are something that people could potentially have at home. I do prefer the hybrid or a hard chamber for a clinical environment. They're easier to clean, they're safer, there's less claustrophobia, but they would be utilized well for general immune modulation. So yes, you're going to lower the inflammatory cytokines, improve the anti-inflammatory ones. You're going to mobilize stem cells in your bones, in your organ tissue, in your brain to create overall wellness and healing. So the biggest key there with marketing would be like a lot of other preventive modalities. The question is, if I do one, is it good for me? Yes. But if I do one, am I going to feel it? Maybe, maybe not. It's still good for you.
Perfect. Very clear. Thanks so much, Doctor.
Mm-hmm.
I'm going to answer the next one, which is a little more technical. So they ask, who can operate this machine? Is a nurse or someone with a medical background required, or anyone can, with the right training, operate it? The answer is yes. Any person, of course, very well trained. Actually, this technology by Verica train all the operators to use the chamber. The only thing by regulation is that indication must be by a healthcare professional for sure, but the operation could be made and performed by any person, even with no medical or health background, okay? I have another one actually for Dr. Elizabeth here, someone from Germany. So thank you so much for connecting. How long does this change hold on after treatment?
The evidence points to up to 3 months or longer. So most of the studies didn't follow people's blood or cognitive performance for much longer after hyperbaric treatment. But I did mention in my talk, and it is helpful to understand why someone is in the chamber in the first place. So if they had a brain injury, a stroke, an illness, an injury, and recovered, that recovery could be expected to remain in perpetuity. If somebody had a new injury or accumulated injury and saw decline again, then that would be the time to resume hyperbaric therapy.
Very good, thank you. I have another one for Dr. Randy here. It's pretty much general, but there you go. So how is the protocol for neurodegenerative disease? I know it's specific for diagnosis, but what about that, Randy? The protocol.
Well, there's a lot of protocols that have been talked about for neurodegenerative disease. Dr. Bredesen that I mentioned really kind of framed the first protocol. He called it the RECODE protocol, and he has one called PRECODE for people who don't have neurodegenerative disease and they're trying to prevent it. And so I did training with him in early 17. And then after that, I did training with Mark Gordon, who talks about traumatic brain injury, and he offers a fellowship in hormone optimization. And then I did training with the University of Pittsburgh Medical Center on traumatic brain injuries and post-concussive syndrome. So there's pockets where people talk about this treatment's for Alzheimer's, that treatment's for head injuries, this treatment's for PTSD. And what I've tried to do, I just got back from the Institute of Functional Medicine last week in Las Vegas. I attend continuing ed 3 or 4 times a year, and then I've put together what I feel like is this generalized protocol that just helps reduce the risk of fading into one of those degenerative problems. And I call it the enhanced protocol. So that's a proprietary thing. That's how I approach it, because I'm standing on the shoulders of giants. I'm taking industry experts who have outlined methodologies to address a certain underlying problem, and I'm combining those because I'm not just a head injury guy, and I don't just see people with dementia. I really see the gamut. I had a patient yesterday that was just released from the hospital that had a stroke. I had a patient in the hospital today that's a post-chemo patient. So they just went through cancer and had chemo brain because the chemotherapy really kind of messed up them neurologically. So the enhanced protocol is my approach to addressing neurodegenerative disease. And if people want to learn more about how I approach that beyond this summary, my website is called amindforallseasons.com.
Great, thank you so much. I have another one here, but any of you can answer, which is pretty much general also. That says, is it possible to use the HBOT in patients with kidney and cardiovascular transplants?
Yes.
For any of you? Yeah.
Yes, there thankfully are very few contraindications to hyperbaric, depending on pressure and atmosphere. So again, this gets back to which device someone has or whichever one you're using. The lower atmospheres would generally be safer. The higher pressure, the more there may be some particulars. The most important is Valsalva. If someone cannot pop their ears, it is not a good idea. And then of course, claustrophobia being another one. But for the most part, people are safe if they are under guidance and not doing this on their own.
Yeah, and I would add to that, this was a topic of particular interest to me because I have a son that had a kidney transplant at age 17. So I've been very thoughtful about how we would approach people with transplant. And I think the one thing I would add to Dr. Sierakowski's remarks are that individuals with transplants are typically immunosuppressed. And when you do hyperbaric, one of the thoughts is it will stimulate the immune system. And so then the question is, would that push them into a rejection, like a graft versus host rejection? And the general answer is no, it doesn't stimulate that part of the immune system that causes rejection. And the way we would know that is you start to integrate hyperbaric and people continue to look at their counts, right? They looked at, so in my son's case, he has a certain panel of labs that he does every single month. we would just stay on track and continue to monitor those things. But by and large, it's not contraindicated. And in fact, many of those people have many of the same benefits without inducing a reaction when they do hyperbaric.
Thank you. I have another one that I'm gonna take a place and answer. Actually, pretty related with the last question and the answer of the doctors. What are the risks, especially concerning pressure and oxygen, and how can they be avoided? So definitely a big amount of the risks and contraindications are related to the pressure and the time of exposure, of course. And most of them starts from 2 atmosphere, 2.5 atmosphere. So it's very proven, and the evidence is available that the medium pressure, which is from 1.4 to 1.6, 1.5, specifically for neurological patients that faces range of pressure to treat them. So all the neuroexcitability, pulmonary toxicity, actually barotrauma as well, is related to the pressure. So it's very well explained and known that you can get the same benefit and you can get the same results, even better, with actually a frame layer therapy and equipment with a medium pressure. So for regular conditions and common situation and diagnosis, the best range is it's medium pressure, no risk, and not that much complications. Then
I have a quick, I'm sorry, just to piggyback on Elizabeth's with the Valsalva maneuver.
Yeah.
Because I have had a handful of patients that really had a lot of trouble pressurizing. What I ended up getting was, I think it's called an ear popper by Summit Medical. It's an FDA-approved device. But that one is it's a lifesaver for a lot of people to pressurize through the whole thing, through the whole process.
Great, thank you, Chris. Well, guys, I think we're done basically for now. Let me remind some important things. The first thing is that we're gonna post this event recorded in our platforms by Radicate.com, so you will find it very soon, 1 week or 2 probably. The other thing is at the beginning I told you that we have kind of a gift from Mira to all the participants today, and my team is going to be posting now in the chat a coupon for access to the courses that are available at the Mira website. The coupon is, I have it here, it's going to be HBUT 2024. My team is going to be writing right now on the chat, so you can get it, and you can use it through the Mira website, www.imira.com. Okay. Well, guys, thank you so much. One of you, Dr. Elizabeth, thank you so much. Dr. Randy, thank you so much again for your time and for your presentation. Dr. Pepitone, thank you so much for your time again. And thank you guys, all the guests, all the registered participants for joining us today. Remember, everything available again in our website and our platforms. We're gonna share this and more info now and the days forward, okay? Thank you so much and have a good one. Bye-bye.